You cannot become like a general surgeon who's good at everything. I think every university should have now a prompting course to teach medical students how to write a prompt. I learned more in these 6 weeks than I've done in the last like 2 or 3 years on my own.
Hello, Dr. Mohsen. Nice to have you on this interview. Just to introduce you a little bit to our viewers and listeners. So, you're a medical doctor, you are an electrophysiologist, you are a cardiologist, rhythmologist, and you're a research scientist at Johns Hopkins University in Baltimore, USA. And also, you are a member of the global committee of the Heart Rhythm Society, and you're doing research in the field of electrophysiology, cardiology. No, not cardiology in general, but electrophysiology. So welcome to the interview.
Thank you, Suraj. You already know more about me than, than I know about myself.
Yeah, so just to begin with, what inspired you to pursue cardiology?
Uh, uh, Actually, that's kind of funny story. So I studied medicine in Syria, and I was trying to get an internship in Germany. And at the time, it was kind of difficult. You had to ask people why you wanted, like, I had to ask someone for help, so he could put in a word for me. And we were speaking in German, and literally the only word that I could say confidently in German in any like about any specialty was cardiology. I just switched from American cardiology to German cardiology, and that's how I landed in cardiology. And then my first week there, I went to the cath lab and I attended a procedure. It was a procedure about ablation of Wolff-Parkinson-White syndrome, so an accessory pathway. And there were very nice people at the lab, and they explained the thing to me. At the time, I was a med student. I couldn't read an ECG or even understand what's going on. But so they explained it to me, and then the ablation went on, the procedure, and then they treated it, and you could immediately see an effect, and I was hooked.
Perfect. So the procedure, you just jumped into cardiology by accident because you could
Exactly.
pronounce the word in German.
Yeah, I thought I was gonna be an orthopedic surgeon, but then I did an internship and I was clear, no, cardiology is the one for me. The signals, the ECGs,
Mm.
um, and the good thing about cardiology as well that I realized later is it's multifaceted. So there are so many things you could do in cardiology. You could work with your hands in interventional. You could do prophylaxis. You could do echoes. You could speak with patients, do consultation. So it's you could operate and implant pacemakers and devices. So there's so many things to do. So I think even if someone is not exactly sure, cardiology is one of the best options because it offers a lot of like subspecialties in the future.
Yeah, sure. That's also what I experienced in my internship at your department because we had so many things, different experiences, and I was overwhelmed with the opportunities. And also standing next to you in the cath lab was like blinking everywhere, this light here and there, some curves, but as a student, of course, at that time, I understood nothing at all. But with time, you get into it. Okay. Did you have like any, speaking of the beginning, did you have any mentors in the beginning that hooked you to the field or that mentor you through a difficult time in the beginning, especially, or who shaped your cardiology career, let's say?
Right. I'm not gonna name names because then there are so many people that influences, and it's an essential part of your like medical career is to have a good mentor or mentees, and to be a good mentee. And then of course you always like it does not work one-way street, so you cannot expect from someone just to come by and like teach you about things. You have to show interest, you have to put in effort. And this is, you have to have both sides to succeed. So I was very lucky. I was motivated as a medical student. I would stay until like 9 p.m. at the catheter lab and like watch procedures. And when the like specialists at the time, they saw my motivation and they saw my drive, they started like taking like to me and explaining stuff. And of course, not all of these people, like not everyone is a good mentor, not everyone is a good teacher, but you will end up like you'll recognize one when you see one at some point, and then these people, I mean, generally, like a lot of people are willing to help once they see that motivation. The same goes for you. You came to our hospital many times, and when you see someone that's showing interest, even I think as a med student, like we like a lot of the advice is when you're in cardiology and you want to learn, even if you're thinking about doing like surgery or doing like I don't know dermatology, should still show interest, and that would make a difference. And ask questions, of course, and like at least show if and well, the most important thing, if you don't know anything, if you don't know the answer when someone asks, you just say, I don't know, but can you explain to me? Because we see it a lot with med students that they're, oh yeah, I know, and then they don't know anything. So back to your question, it's definitely like both ways. You have to have great mentors, and you have to show them, like you have to make it clear to them that it's worth their while teaching you and putting the effort into you, because that's what you, currently as a mentor, that's what I like to see in people. I'd like to see people who are putting in the effort, showing me like, and to be honest, when you're a med student, you like you can afford to spend extra time uh, like at the lab. This is the extra hour that this is what would distinguish you from other people. And you get tips from a lot of people on how to deal with the hospital, how to help the nursing staff and prepare for procedures. And I think this is what many people ignore. You learn from nurses at the hospital in the first couple of years more than you learn from any doctor.
Mm,
So this this is actually, and this is a tip was given to me by one of like the consulting, one of the doctors. He was like, you have to prepare for procedures, you have to clean up afterwards, you talk. So that's where you end up learning a lot of stuff,
yeah,
and that's how I started.
very, very cool. Speaking of medical students, what would you advise medical students that are choosing their subspecialties now, or they don't know exactly what they should pursue in the future? What do you think? What are good parameters to look out for?
I think like the most important thing for me is to keep your options open. You don't want to go into something like very specialized very soon if you're not sure you want to proceed with it. And second of all, you normally don't like you have to try stuff to figure out what you like and what you don't like. At the end, you're going to be doing this job for a very long time, and it should like it should be either interesting for you if you're like someone who likes some excitement in their daily life, or you're in it for the money, or you're in it for the schedule. So you have to know what you want to do and you don't want to do. And you should remember that you're doing that not only during your 20s, but also during like when you're 40 and 50-year old. So if you think on calls and emergencies are exciting when you're 28, they might not be the same. Like getting on call when you're 50 and you have kids at home is tricky.
Mm,
So try a lot of things, see know what you want to do in life. Do you want to do like figure out doing the way you do want to do research? Do you want to be like more on like, let's say 8 to 5 and then go home and have nothing to do with your job anymore? Do you want to have a practice? Do you want to work at the ICU? This is like, it's very different careers. My brother is an anesthesiologist. He worked like intensive care medicine. He is emergency doctor. That's a huge difference to what I do. I don't have on calls. I don't go on weekends. When I finish work, I go home and that's it. For him, there are shifts. It's a different dynamic, and everyone has different kind of energy. And I think you will figure it out pretty much within the first like 1 or 2 years of your residency. And that's why you should try when you're doing your internship, like try as much as possible.
Mm. Yeah, so you just have to plan ahead, I guess. See what you want to do in the future and try a lot, and then you get to your answer eventually.
Yeah, as I said, like you cannot do anesthesiology for like 5 years and then say, oh, you know what? I always thought like I would want to have my private practice because it's more challenging to have a private practice than when you're a cardiologist or internal medicine or so you should keep this in mind. And normally, like, but in the end, you won't be able to decide anything. Something will happen by chance but like choosing cardiology, but at least y- like you have the possibilities to explore and to make an informed decision when you can.
Mhm. Speaking of cardiology, what do you think are the key skills that medical students or a pursuing cardiologist should learn? Yeah, in regards to the field, which is very fast developing. More than me, cardiology is very, very fast developing. New research um, comes online every day. So, what do you think?
I mean, cardiology is one of like there's so much going on. There's a lot of funding for research and a lot of people die of cardiac stuff. That's why everything is evolving. I don't think there is something special. So if you find yourself interested in signals or in three-dimensional shaping, so electrophysiology is might be the case. If you want to do devices and with some hand skills, so this is the case. If you want just to do like if you have good people communication skills and so consultations and prophylaxis and follow-ups, this is what you end up doing. You could if you want to work with athletes, then you end up with sport cardiology. So there are so many things, and I think it's not like more of a skill you learn to see where you like how you could get better. It's more like you find out what you're really good at and what you really can like capitalize on and then
Mm-hmm.
figure it out and then choose it for your and choose your subspecialty accordingly.
Mm,
That would be, I think, more successful if you pick something you're already natural at, like let's say following signals or understanding shapes, and then you will more likely to succeed in this field than when you're forcing it. I've
mm,
seen a lot of people trying too hard to become things they're not, and if you wanna, you like in cardiology, you cannot become in medicine in general. You cannot now it's so subspecialized. You cannot become like a general surgeon who's good at everything.
mm,
You pick one thing and then you be great at it, and that's what's like how the field is developing now.
mm,
So in order to increase your chances of being great at something, you should choose something at least you have more like natural talent to, or more drawn to it in general.
Do you think it's possible to be good academically? I mean, like in research and clinically at the same time?
Yes. However, it is very challenging to find the right place where you could excel at both. I think it's very challenging and finding the time and the drive to do so. So, for example, for my hospital, we were not that strong academically at the time when I started, and you notice like if you don't have a research structure, it takes you a long time to build something and to learn a lot of stuff that you would learn in a few weeks somewhere else. And this is a very important point is that you don't if you have to be in the right place to learn like that skill. I know this is not like what you asked, but this is an important point is if you want to be good at research and you are working at a hospital, uh, that don't have a research structure, it will take you forever to start everything and start building like and learning about statistics and learning about how to write a paper and finding because you need people to help you and direct you in the right way. And you will end up benefiting way more from going for 1 month or 2 months to a place that does research as like systematically and then you will learn. And this is in my career, I found it like maybe too late. I was struggling a lot with research, trying to build something, and we were actually succeeding. But then I like after an advice from two of my colleagues, I went for like almost like 6 weeks to Sweden to clinical research center in Malmö, and I learned more in these 6 weeks than I've done in the last like 2 or 3 years on my own or with one of my colleagues, like trying to guide me through the research world. Because so you have to see what like the advantages of the places you're at and use them. And it's definitely there are some university hospitals where you could learn both, but then of they all come with challenges. So you're normally, if you're investing more time in research, you're not spending a lot of time in the cath lab and working on procedures. And what I learned to value from my experience is that it's my like in my situation, I gained a lot of clinical experience, then started research. And so this clinical experience and what we lack in our field helps or shape my research interest to something more clinical and more interesting. And I would say most of like people who go into research start with research and then switch to clinical.
Mm,
There are advantages and disadvantages to that, but I'm very grateful for my like journey, because now I work at projects that I've dealt with a lot in the past, and I they excite me and I want to improve. I know what's wrong, and this is something important. I think ideally you'll have both at the same time
mm.
building, but you cannot have everything. So you need to like if you're at university hospital, maybe focus on research. If you're like at a hospital where you have a lot of hands-on experience, then get that, like savor it. And then once you reach a level where you're not improving a lot, try to go like, don't try to build everything and reinvent the wheel. Just go for some place where they can teach you and help you evolve.
Okay, so from what I understood, to be good at something, you should go somewhere where you already have a structure, so they can teach you. I mean, if it's, for example, if you want to pursue clinical career, maybe you should go to a university hospital with a lot of patient turnover. And if you want to be good at research, maybe also university hospital, but some place where you have a structure already.
Yeah, you should. I mean, you should be able. It's difficult to judge what's how things are going. Like if the people actually, because some people will say, "Oh yeah, we'll do a lot of research here." So just look at their publication list. Look at what's going on in the last few years. Are they doing that? Ask for other people experience who've been to that place. And if you want to be good at something, you should always surround yourself with people who are better at this thing than you are. So, and who are actually willing to teach you. So these are the two different things. And for me, the experience, as I said, in Sweden, where systematic research structure, I sat in a room with multiple people who were like their only goal in life is just to do analysis and write papers. And so it you learn so much from these experiences. And there is an anecdote from an old like story about a person who said like was dreaming of becoming, and it's a true story. He was dreaming of becoming like the king or the prince of the area he's living in. But at the time he used to work at the market, and he had a donkey, and he would deliver like grocery to people who buy at the market. So from his place, it's almost impossible to get there. But then he thought, well, the only if I want to achieve my goal, I need to be at least somewhere where it's even feasible. And then he joined the police, and then he kept rising in the rank, and he eventually got there. And actually, like he did become like the prince of that city at some point. So and the same here, like if you want to become a researcher, you shouldn't hang around at like where there's murder at the market. You should like go someplace where they're actually good at it, where there's potential, where there is guidance, where there's a clear structure. You cannot go like to a small hospital in some village. You can, but you'll make it more difficult for yourself.
Mm.
And if you want to be you worked on great, like have a great experience, hands-on experience. You cannot go like as a second year residence to a university hospital and say, hey, I want to like have an hands-on and I want to be able. It's very unlikely to happen if you show initiative and maybe stay late and get like go on calls and stuff. I did that, and you increase your chances, but it's more challenging. So figure
Mm,
out what's feasible and work on it. And while you can still invest time and energy, like when you're young and you don't have commitments or family, this is the time where you just stay so late or like, hey, tell like a consultant, I want to do like on calls with you if you get called for a surgery or an
yeah.
emergency. I want to come. This kind, you learn so many things. You would like people will teach you like really with
Mm,
like everything possible because they appreciate the effort you're putting in that
mm,
aspect.
yeah. I think this is also a key principle, like showing effort, showing initiative. And from what I know, you just came from a congress recently. I think 1 week ago.
Yes,
Um,
last Tuesday
yeah,
I
last
was in New
Tuesday. So
Orleans.
you were at the American Heart Association Congress in the US as well. What was your, I mean, what did you learn there, or what was the most interesting, yeah,
So for
recent,
yeah,
yeah.
conferences are actually, I encourage everyone to go to conferences, and you'll soon realize like the right way to do conferences is not actually like to attend sessions or like because or guidelines. You will able to see the guidelines anywhere at some point, and conferences are a unique chance where you have so many prominent people in that field at the same location at the same time, and you get to speak with them, you get to find them and then ask for help, ask for advice, ask for ideas and feedback. And this is the biggest thing you could do for your career. So you can, and for me, for example, the highlight of that conference, I was there for 3.5 days, is that for actually like almost every day I sat with one professor from Ohio State and we were discussing one of our projects. And it's so difficult to get time with such people because they're very busy. And if you pin them down and you you have a system,
You have
then you
told them
have
there.
yeah, exactly. You will be able to like meet these people and network and then it's very different when you make impression on people like in person than when you send an email or and even if you encounter people with for 5 minutes, at least they'll put like a face to their name. So when you send them an email later, you're asking them for any like help or insight or maybe an opportunity to start working. Uh, and you're like people don't say no that often. They're more likely to say yes. If you go to someone and say, "Hey, I like your work. I was wondering if I can like do an observership or internship for a couple of weeks, or if I could like meet work with you. I wanna work." That's like I've I'm telling you, no one has ever said no. And when the chance when you send these people email afterwards, they're more likely to answer and maybe get a selfie with that person. So you can send them an email like you show them, oh yeah, we met, so they remember you. So
Oh,
this
that's
is
a
kind
good
of
tip,
trick.
actually.
Yeah, like get a selfie so we right say something memorable to them so they can remind you and say, by the way, I was the guy like from here. And because a lot of like important people or in medicine or in any field, they have so many like they receive hundreds of emails a day, and you need to stand out. You need to like have at least, and if you met them in person, they will mostly remember you, especially if you have like a picture with them. So they'll and that's how I got the first research position at like in Lund Lund University at Lund University in Malmo, and that's how actually I got my position at Johns Hopkins in the US. Is that I met the professors at the time at conferences. I spoke to them and they somehow remembered me, and then with emails and contact. So, and of course, but you shouldn't go to a conference if you're not presenting anything because you should have like something to, well, you can, of course, but you should also have something to present because these people are going to ask you, are you here to present something? And they'll see that you actually like have a project, you're working on it, you're following through,
Mm,
and it's a great opportunity to network and meet people who have similar interests to you. Most of our collaborations come from conferences, from meeting people who are like interested in the field,
Mm.
and what I learned recently is that you need to be visible online. You need to post about it. You need to tell people. That's the world we live in right now, and you have to, if you like it or hate it, you have to live by it. You have to respect that. That's how things work right now. So
Yeah,
yeah,
world is changing.
it is.
And on that topic also, the world is changing to better or to worse, we don't know, but we have many opportunities in medicine. You're also dealing or doing some research about machine learning. What can you tell me about that? Or what's the future of machine learning also in cardiology? What do you think?
Well, I mean, it's not only machine learning, it's any kind of, let's say, machine learning, deep learning, any kind of AI associated kind of and research. It is the future. There is no like it's inevitable, and we have to understand what tools do we have and to do research. And from our work, how much time you could save through automizing things and through looking at using like the right tools, using the LLMs. I use them for everything, and they're evolving on a great rate. And I think you asked about machine learning, but for me, I think the more important now is how to use LLMs in research and how to leverage them. And so prompting is the new, like I think every university should have now a prompting course to teach medical students how to write a prompt, how to speak with the LLM, how to get them to get the results they actually want and looking for. And of course, with machine learning, we started like statistics. Normal statistic is very like our has been there for forever, and actually machine learning has been there forever also, but the use in medicine has not been that common, and now it enables us to see so many patterns that we did not see before, to recognize a lot of stuff, a lot of hypotheses, or and help us guide the future research. So this is also something I think in the US many med schools started like getting AI into their integrated like med school system. And if you want to survive in this field, I don't think I think that's the only way to go about it. You cannot avoid it. You have to.
You have to work with the new technology.
Yeah,
Yeah.
absolutely.
Do you have other things in medicine that where you think, okay, that's very promising now in cardiology for the future?
Everything. Everything. I mean, the amount of work now, like you see the data banks, the biobanks, a lot of amount of huge amount of data, huge amount of computational power, and everyone is just figuring so many things at new time. And we need to understand how to deal with these technologies as well. So everything in the field is exciting. People might get scared because, oh, there is no place for humans anymore, and there's always going to be place for humans in everything, especially in medicine, because of liability, because of expertise, because of it's the role might change, but we're still there. So don't be scared just like, oh, I'm not going to do radiology because it's going to disappear. It's not. It's impossible. Like it's not. It's very unlikely to disappear. And radiologists maybe 10 years from now would have a very different role. Dermatologists as well. Even cardiologists will just concentrate on more like special tasks and leave all the general things to the AI.
Mm.
And that's uh, like actually interesting because a lot of our tasks as doctors is just time demanding and just like office work and
Mm.
writing reports and stuff and these kind of things that would I would be happy to let any AI take over and just concentrate on more detailed stuff that are like makes our life more exciting and makes our patients' life hopefully better.
Yeah. Yeah, so one of the last questions for this interview, you've obviously been in Germany for a long time. Now you are in the US. What do you think are the differences in cardiology in these two regions of the world?
Um, Actually, cardiology is very, very similar. So even at big institutions here in the US, you think they do things differently. They don't. We're like as good, we're better in many things in Germany. The biggest difference between the US and Germany is actually like the research structure and the idea you bring up med students. Here, everyone is working on a research project, on an idea to develop, to look for research, to look for funding, to improve something in the field. And I think this is something I really find interesting about the US that does not really exist on this mass in Germany. In Germany, everyone wants to do a Doktorarbeit and like their thesis and then get done with it and just to get a title. Here, there are more incentive, there are more like the innovation mentality. And I think I hope to see this in Germany in the future. Of course, many things about our practice in Germany are better because we have a better healthcare, so we can afford to do examinations, do procedures, and a lot of patients that are not possible in the US. But as I said, eventually, like research is what drives the world, to this advancement, and having the structure to be able to perform these kind of studies or like teach or educate people on and prepare them to go through with research and to be innovative and think out of the box. This is something we still need to work on in Germany.
Hmm. So we have a long way to go in Germany as well. Okay, and the last question, what do you, in your opinion, do you have any last words or any tips for medical students? Um, what should I take away from this interview?
Okay, I'll start with LLMs, with AI. Learn how to use them, capitalize on that, save yourself times. It does not mean to get lazy. It means you have more time to focus on different things. For your career, keep your options open. Invest your time while you still have it and can afford it, and you have the energy. And once you decide on a top, like be in the right place, try to have yourself surrounded by the right people. You, if like having toxic mentors or mentality around you is not going to help, so try to change that. And there are places where a lot of people are willing to help and teach and move people forward. And when you find what you're something you're good at, stick to it, try to capitalize as much as possible and improve yourself because that's going to be what like separates you from all the thousands of med students around. And in during this time in try to enjoy the journey. You're only going to be in your 20s once. And of course you can afford at some point like to put in a lot of time and a lot of energy, but then this cannot go forever because you're going to burn yourself. So if something would take 1 month or one semester more to achieve, but it will help you at least enjoy life or like avoid a burnout, do it. Nobody like this mental health and physical health is very important. So 1 semester, 1 year might seems like crazy for you, but like, oh my God, I'll graduate 1 year later if I do like this something in between research and everyone is doing it at the same time. Um, Sometimes if you can, if you're up to it, you should, but if you don't and if you think it's too much, just like take a gear down, take more time and do everything on your own pace.
Thank you very much for your time, Dr. Mohsen.
Thank you,
Thank you very
Ziad.
much.
Have a good day. Bye bye.
You too.